Hello everyone, I'm Dr. Swati Agarwal, dermatologist from Skin Nation Clinics, Delhi. So today I'm here discussing about a very commonly done treatment at dermatologist clinics, which is chemical peels. So what are chemical peels? Chemical peels are advanced medications that are concentrated forms of various hydroxy acids, that can be alpha hydroxy acid, beta hydroxy acid and other such active agents that are used on your skin to give some results that might not be possible with other everyday use topical agents that you use at home. What are chemical peels used for? So chemical peels can be used for various dermatology indications, for example acne, pigmentation, leftover marks after acne which we call as post-inflammatory hyperpigmentation, tanning, photo-damaged face, then fine lines, aged, signs of aging, sunspots. So these are the various indications for which chemical peels are used. Who is a good candidate for chemical peels? Anybody who is actually looking for some pleasant anti-aged changes on skin, or looking for betterment of concerns like acne, pigmentation, even superficial scars and signs of aging is a good candidate. How to start chemical peels? First and foremost is to meet your dermatologist, get your skin examined, because before you do a chemical peel it is important to know whether your skin is dry or oily or combination. Second is to discuss the indication, that is why do you want to do a chemical peel and whether you should go for it or not. Then only it is decided whether to do chemical peel for you or not to do it. So when not to do chemical peel, many times we discuss when to do, what to do, but what are the indications why and when chemical peel should not be done? First and foremost is that if you have any active infection, that is if you have a lot of folliculitis, if you are a patient who frequently develop herpes around the mouth, or if you are too dry patient, if you have not prepared yourself for chemical peel, just not blindly jump into it, discuss with your doctor. You might be a candidate later after some stipulated duration of treatment. So what are the various types of chemical peels? Nowadays with advancement of aesthetic industry, there are so many chemical peels available. What we need to know is the basic ingredients, and many a times it is the combinations, that is ingredients are combined together to give better outcomes. So most commonly used ingredients in chemical peels are alpha hydroxy acids, for example glycolic acid, beta hydroxy acids, for example salicylic acid, lightening agents like hydroquinone, arbutin, kojic acid. Also retinol peels are very commonly done for pigmentation and fine lines. How many sessions of chemical peels to be done? Now this question has a different answer for different patients, because the number of sessions that you need depends on many factors, for example your age, your indication, your severity of disease. For example, if a patient has few acne, they will need less sessions. If you have too many acne or severe acne, you might need extra sessions. So the number of sessions can actually vary in different patients, different body areas and different indications. What are the various types of peels? So see, peels, as I was saying, can be mono peels, that is a peel has only one active, for example only glycolic acid peel. Or it can be combination peels, for example something that has glycolic acid also, salicylic acid also and lightening agent also. So it's a combination peel. Also there are differences in peels according to formulation. For example, there are water based peels that can be a little more effective, but they do not go for dry skin. On the other hand, there are gel based peels that might take a little more number of sessions, say 1-2 extra sessions, but they would be very safe and they go really well for all types of skins, even for dry skin. When should I start chemical peel? So one most important rule of thumb is that chemical peel should always be done after preparation. So we in medical terminology call it as priming of the patient. That is preparing your face. For example, if you are doing it on your face, preparing your skin before the chemical peel procedure. So this priming procedure and the duration of this should be at least 10 days, and if the patient is not in hurry, then at least 20 days. So what is this priming? Is that we give you some creams, photo protection in the form of sunscreen for at least 10 to 20 days before your peels. Benefits: first, because the skin is prepared, the ultimate outcome of this chemical peel will be more, and also the safety of chemical peel will increase. What are the side effects? So with chemical peel, if the constituent is not selected well, if the concentration of the constituent, for example glycolic acid, if it is too high a concentration, if the skin is not prepared properly, that is priming is not done, if the skin is too dry, you can have some complications in the form of some rashes, some redness, some PIRs, that is post procedure or post inflammatory pigmentation. Most of the time, if the peel is chosen by the dermatologist, if patient is prepared well, and if the glycolic or any other the peeling agent selected is correct, most of the complications, even if happen, are transient, and in the best scenario they don't happen because you have prepared yourself well. Can chemical peels be combined with other procedures? Absolutely yes, but again it depends on what indication we are treating, and will a combination treatment go well with it. For example, many a times chemical peels are combined with laser treatments. So this goes well in patients of post-inflammatory hyperpigmentation, photoaging, and many a times in oily acne prone skin patients also. Which combination modality will go well for you depends on your skin type and your skin concern. Therefore, it needs a detailed discussion with your dermatologist. So what is the downtime with chemical peels? This is a very frequently asked questions. So with the gel based peels available nowadays in market, most of the time there is very minimal downtime. Therefore, it is also famous as a lunchtime procedure. That is just between your break, between your your job or your work profile, you enter the dermatologist clinic, get it done and get back to your work. Famous as a lunchtime procedure itself means that the downtime is minimal. Also, there are very famous peels like party peels, which you can just get done a day or two before your some upcoming occasion, and you are just ready to go for the party, and therefore famous as party peel. Yes, there are other peels available, for example yellow peels, in which the skin might exfoliate and look dried up for at least 5 to 7 to 10 days. So there is a downtime involved with such peels. If you have something important coming up in the coming week or immediately after your peel session, it is very important to discuss with your doctor. There is another very famous peel nowadays called as Cosmelan peel, where downtime can be as long as 1 month. So it is very important to know what is it, what are your indications, what is the downtime of the procedure. So have a detailed discussion with your dermatologist before you get on your chemical peel. Another last thing that I really want to tell to all my viewers is that chemical peel should not be a home done procedure. Please do not blindly follow the influencers or the people on Instagram. We get across patients who have used peels at home after seeing an influencer or somebody on the social media, and their skin actually got burned. So this has to be an office done procedure at a dermatologist's place. Thank you so much. If you have any other question on chemical peel, feel free to ask in the comment section below. We'll be happy to answer it. Stay tuned to look at our next videos. Thank you so much.